Welcome to another presentation from the CV Academics Foundation, home of the AMP Honors Program.
All right, so welcome AMP Honors Program members. This is a career highlight with Dr. Matthieu Mayer, a neuroradiologist resident at MCW in Milwaukee. I'm Matt Zamzow, a supermender with CV Academics, who will be talking with Dr. Mayer today about the profession and, kind of a day in the life. So starting off, what is radiology?
Yeah, so actually I recently changed course and I decided to go, I decided to subspecialize in musculoskeletal radiology instead.
Okay.
It was a tough decision. I definitely like a lot of different things about radiology. But I guess that leads it into your question. So radiology is a lesser known subspecialty in medicine for physicians who specialize in all aspects of medical imaging. So what we primarily do as diagnostic radiologists is to interpret all the various medical imaging exams, including X-rays, CTs, MRI, ultrasound, any sort of nuclear imaging, such as PET-CT, as well as all of the various image-guided procedures. And some of those get more into the interventional radiology realm, but diagnostic radiologists also do a number of different image-guided procedures.
Awesome. Kind of building off that, I've heard, radiologists, they're looking at images all day. They kind of call them the cavemen of the hospital sometimes in their reading room. Is that how you would describe it? Kind of describe a day in the life for us.
Really, I think it's sort of a misconception that we spend all of our time in the reading room. Some people spend more than others, but to a certain degree, all of us get out of the reading room and do procedures, at least sometimes. So, for example, people in neuroradiology will go and do the lumbar puncture procedures or myelograms. People in body radiology will do things like thyroid biopsies or lymph node biopsies, or even sometimes like here at MCW, the body radiologist will put in drains for abscesses and things like that. A sort of day in the life for me right now, I'm still a resident at this point, so I'm still doing my training. So depending on what rotation I'm on, right now I'm on the pediatric radiology rotation. So what I do, I got here around 7:30. We had a lecture in the morning from one of our thoracic radiology attendings for about an hour, and then I started on the clinical service. So right for me on peds, basically what I'm doing today is I'm interpreting all of the pediatric ultrasound, as well as a lot of the plain film or radiographs that come through. And that'll also vary by day. So tomorrow, for instance, I think I'm on neuro for peds neuro. So I'll be reading all of the pediatric neuroradiology cases. And since I'm still a resident, what I do is I come up with my best interpretation of the study, and then I'll go over it with the attending, or I'll send it to the attending, and they'll just check to make sure I was right, or if I was wrong, which is also okay. They'll make whatever changes and then let me know and give me feedback so that I can keep getting better.
Yeah, biggest part about learning is, being able to admit when you're wrong and it being okay. So that's a huge part. How did you learn about and become interested in going to med school and then, picking radiology as your residency and your specialty?
Yeah. Well, it started off as sort of just a vague interest in medicine, probably when I was in high school. I've always been somebody who wanted to help others in a significant or personal way. So basically, interested in helping people, interested in human anatomy, pathology, physiology kind of stuff. I'll put together, and that sort of directed me toward medicine. Then in college, I tried to take classes that that were obviously the prerequisites to be able to apply to medical school. And as I was able to do well in those classes, it let me know that, okay, I have a chance at this. It's a competitive thing to do. And sort of early on, I really had to adjust how I approached um, my college classes, because studying in college is very different from what you had to do in high school in order to do well. And and starting off in college, I was like, I was a little taken aback, because what I had been doing wasn't working. So I had to quickly adjust in order to get myself back on track to be able to actually get the grades that I need to get into med school. Just as an aside, but
Out of curiosity, did you then have to change your study habits from college to medical school?
actually, I found that a lot of the habits that I had built in college to be able to do well translated really well to medical school. So things like um, making sure I knew what the learning objectives were, being able to really fill out in detail each of those learning objectives, because those are really what the professors will pull the exam questions from. Or if there's study guides, like questions at the end of each chapter, more active learning techniques, like doing the practice questions in the books and things like that, as opposed to like passive learning techniques, like just taking notes and like reading over the notes. That stuff didn't work as well. So
Mhm.
there's a number of different areas that we can go into. So as we already talked about, neuroradiology is one. Those are going to be the people who read all of the brain MRIs, spine MRIs, and then brain spine CTs, and also like face and neck imaging. Like for people with head and neck cancers, they'll also typically take care of those studies. MSK radiology, which is the one that I ultimately decided on. These are the people who will interpret all of the various joint MRIs for people who are having sports injuries, knee pain, people who break bones. So basically all of the joints imaging, all of the bone imaging, as you might imagine.
Mhm.
And then they'll also tend to do things, well, at some institutions anyway, they'll do the bone and soft tissue biopsies. So if someone's discovered to have like a tumor in their muscle or their bone, here at MCW anyway, the MSK radiologist is the one who will biopsy that. Just as an aside. Some of the other areas in radiology, breast imaging is its own dedicated specialty for screening women for breast cancer, and then continuing that workup, biopsying the lesions, and then getting that patient plugged in with the appropriate follow-up with the surgeon if necessary, with the oncology team if necessary. Nuclear imaging is another subspecialty. So as I mentioned earlier, nuclear imagers are the ones who interpret all the PET CTs, PET MRs for people with cancer, determining if there's metastatic disease, where it is, and further characterizing those things. Additionally, nuclear imaging entails all sorts of other sort of examinations, like seeing if the gallbladder is functioning correctly, for example, or seeing if the stomach is emptying right. There's all sorts of other things that they do. Moving on, then there's pediatric radiology, which is the rotation I'm on right now. So obviously specializing in imaging of children, typically up to age 18. Children are not small adults, is what
No.
pediatricians will always say. And pediatric radiologists would probably agree with that most of the time. Anyway, it has a lot of its own very specific knowledge, and it is its own fellowship as well. Let's see, what else haven't I mentioned? So body radiology is one of the most popular subspecialties to go into, because it's a very versatile thing, especially for people out in private practice. So basically body radiologists will specialize in everything in the abdomen and pelvis, all of the different things that can happen to the organs in the belly. And then a lot of times they'll read some tests as well for patients coming in and getting their chest, abdomen, pelvis CT. Although I should say chest radiology is also its own subspecialty, cardiothoracic radiology. So the chest radiologists will specialize in things like chest CTs, cardiac MR, coronary artery CT, interstitial lung disease kind of things.
You mentioned in the past that your last rotation was an emergency radiology rotation.
Yeah, so emergency radiology is pretty much its own subspecialty now. For people who don't mind working in the evenings and overnight, basically just covering all of the emergent studies that come in. And for us here at MCW, it tends to be a pretty busy service since we cover all sorts of different emergency departments, urgent care locations. The hospital system is always expanding, so it tends to be pretty busy.
Sounds like it. Moving on, what is your favorite and least favorite part of your involvement with radiology?
Well, my favorite part is being like a piece of this greater puzzle for figuring out what's going on with the patient. A lot of times the patient's primary care provider or their inpatient medical team will order a study to try to figure out more about what's happening with their patient, and being able to actually add something valuable to that situation, or being able to really make a diagnosis. I think that's very satisfying, especially when it's something very specific and something that we can actually completely diagnose based on its imaging features. Like for instance, certain tumors will have very specific imaging characteristics. So when we see that on the imaging study, we can say patient has this, and then they can move on with the workup and have that information. As far as the least favorite thing, I think there's sort of a phenomenon happening, and it's everywhere in radiology, where the number of imaging studies that are being done it just continually gets higher and higher and higher. But there aren't as many. But the number of radiologists isn't increasing at the same rate. So basically, we are being stretched more and more thin by the volume of studies that are being performed, and that can be very difficult for a number of reasons.
Yeah, I think that also comes back to, evidence-based medicine and knowing when to get an imaging study and when not to. So hopefully the upward trend will kind of start to turn around and go down as, evidence-based medicine gets more widespread.
Yeah, we can hope.
Yes, we can. Well, I'd just personally like to thank you, Dr. Mayer, for taking the time out of your day to kind of give some insight to the A&P Honors Program and CV Academics members, and kind of, get a sneak peek into the radiology world and kind of what it's like to, work your way up to a residency. So thank you very much.
Yeah, no problem. Thanks, guys.
This has been a presentation of the CV Academics Foundation, home of the AMP Honors Program.